I am Dr. Peter Merkel from the University of Pennsylvania Vasculitis Program, and well, I know many of you I know. I've been doing this for quite a while. It's great to see. What a great turnout as we're back together in person. This is really great. And I've been doing this, I'm not going to tell you how long. So I'm here with Dr. Jen Gordon to break things, to discuss the Vasculitis Patient-Powered Research Network. So let's just start right away. Raise your hand if you're a member of the Vasculitis Patient-Powered Research Network or you're with someone who is. Great. Raise your hand if you're not, if you're a patient with vasculitis and you're not a member of the Vasculitis Patient-Powered Research Network. Oh, you're all chicken. So there's more than that. We've got people going around with clipboards who are going to help you change that status. So I know some of you might have a shoulder that was painful, so you couldn't put your hand up, but identify yourself. We can help with that too. We are rheumatologists. So the Vasculitis Patient-Powered Research Network, what is it, where are we at, and why are we so excited about the progress we've made? So I'm going to go fairly quickly through this because we have a lot of material because we're doing a lot of stuff. You know me, you know Dr. Gordon, who's been a fabulous co-principal investigator with me, and Christine Young. Where is Christine Young? Are you in? She should be in. Christine? She's probably out of the room. She'll make all these slides. So please be sure to greet Christine, who is our our network manager and has been doing a fabulous job with the VPPRN and is here, has information, et cetera, at the desk. Please stop by and see her. I want to make a call out. Diane, where are you? Oh, there she is. Hey, let us really thank the original patient, not the original, but one of our past co-principal investigator and patient partner who really worked with me, and we really expanded the VPPRN, and she's been a tremendous champion, not just for this network, but past lead of the Vasculitis Foundation, et cetera. So Diane, great to see you, and thanks for everything. Just to remind you, because it's good to remind ourselves, our mission is that we are an international research network of patients, scientists, clinicians, advocates, and family members who work to improve healthcare and quality of life for patients with vasculitis through high-level, patient-centered clinical research. We want to find answers to questions that are most important to patients living with vasculitis. We want research that's impactful and meaningful. Our success, we've had significant. We've been close to 10 years now. We've enrolled over 4,000 patients from 90 countries in 25 different studies and 13 different types of vasculitis. A lot going on in the Vasculitis Patient-Powered Research Network. What is our capacity? As you say, we have 4,400 patients and growing. You know, some patients are not as active anymore, but many are very active, and we want to keep adding more. Strength in numbers, more patients, more data. You'd be surprised how important it is to have as many patients as possible. We have lots of countries involved, and we're going to be a big push this year to go even more international because we think we have the capacity to do that. We have a great collaboration between patients and investigators. We'll talk about that. And we have patient-reported data. These are data that you give us. How do you feel? How's your vasculitis going? Which is a different way of looking at vasculitis. And then we ask medical questions as well. But it's all from the patient because we already have other trials and other ways of doing things at medical centers. What differentiates the VPPRN from the kind of research I've been doing in other ways for the past 30 years is that usually the patients come to a big medical center and they fill out forms and we take blood and we do stuff. That kind of center-based research is still very important, and it still is how we do most of our therapeutic trials and a lot of important research and science. But it's one way of doing it. What if you don't live anywhere near a medical center? What if you live in another country? What if there are not that many places doing vasculitis research? So this is a way of participating in a different way, and it's a way of getting data directly from patients without those pesky doctors getting in the way. And I mean that because actually if you try to ask them for things outside of a trial, you're not going to get the information. It doesn't work. So getting the patients, you have information, you know about your disease, and it's really worked well and efficiently. This is a map of all the different countries and all the things, so we're really all over the world getting patients in. We'd like to do more of that. It's English-based, so that does limit us, although some of our studies, the Vasculitis Registry, is actually in multiple languages. We have multiple types of vasculitis. We're glad we reached the threshold of over 100 patients with certain types that are particularly rare. We'd like these numbers to double because you really, really need more and more patients to be involved, because when you do research, not every patient qualifies, different things, you're asking different questions. Once you start asking about how does this compare to that, you really end up with small numbers. So the more numbers we are possible, but everybody gets represented. We also collaborate with other people. So this is, from the beginning, the VPPRN is a partnership of the Vasculitis Clinical Research Consortium, or the VCRC, which I have been directing for a long time, which is a major platform and major international network for research with physician investigators, and we've done multiple things for 20 years in the VCRC, and the Vasculitis Foundation, your Vasculitis Foundation. This is, the VPPRN is, you could think of, it is the research arm of the Vasculitis Foundation. It is a direct way for the VF to be involved in conducting research. And this partnership, which predated the VPPRN, is as strong as ever and has been great. We also have a collaboration with other patient-powered research networks in other diseases, other autoimmune diseases, inflammatory bowel, multiple sclerosis, arthritis. Why? Similar interests, similar medications, similar science. When it makes sense to collaborate, we're collaborating with them. And so that's another interesting way to leverage what we do to make it more powerful. And of course, we collaborate with others and in industry and in other investigators and other funders to try to get the work done. We have, I'm not going to go spend a lot of time. These are investigators. These are investigators that we have had over the years, and I think this is not even a fully complete list. Lots of different people have been involved in the VPPRN work. It's important that it's not just be Jen and me doing all the work. We have lots of people doing things, and I especially probably should have highlighted, many of these people are young investigators. Our VCRC VF fellows, you'll hear more about them during the meeting. Some of them are here. Some of the people who are later in their career were fellows with us. It's very important for young investigators to have a way of doing research that they can lead, that they can put their name on and be known for. And this is actually an efficient, less expensive way to do research, and we have projects that they've been doing, and they've come to us with. And so we're particularly happy about that. But we've got some old folks here too, a mix of investigators from multiple countries who are leading and being part of the research. We have many patient research partners from all over the world and all over different types of vasculitis who are directly engaged in the research. Jen's going to tell you more about that, and we have quite a few that have been involved. So again, it's an exciting way to do research, and we've had a great staff of people that we worked with for quite a long time, and you put it all together, and you have, it's really quite a network of people that are making this work, and it continues to grow and be involved. What about our research studies? So to be a VPPRN research study, it has to fulfill two criteria at least. It has to ask a research question that is important to people affected with vasculitis, a patient-centered approach. If it's not important to you, we're not going to ask the question. It also has to include patient engagement from the beginning, get the patient input, not just filling out forms, which is extremely important, providing data, but give us a thought about how you're thinking about this research question. And there's some other things it also has to be, which is feasible. Can we actually get it done? Can we afford it? Can we make it happen? And will it lead to important findings? I'm not going to go through all of this, but these are the different stages. It sounds simple when I say it, but it actually is complicated to do research. These are the kind of things you have to do, whether you do it at the University of Pennsylvania, and we're running a multi-center study around the world, or if we're doing it online through the Vasculitis Patient-Powered Research Network. But through all of this, patients are engaged, and we do this in a steady, doing research efficiently and doing it with you all directly doesn't cut corners. It helps speed it up. It makes it more powerful, but the quality has to be the same. This needs to be high-level quality research, and that's what we're doing. So some recent studies, just to remind you of, if you haven't, so we did, or some from even earlier, VasWork. This was, what's the impact of vasculitis on employment and income? Well, I don't need to tell you that it can be significant. And this was a way to actually quantify it, to actually put it on paper and publish this and say, look, our patients are really having impact. Some people, not so much, some people profoundly. And that's been published and out there. We did study of skin VAS. Dr. Micheletti, where are you, Dr. Micheletti? I think there he is in the back. He led on this study of the, what is it for patients with vasculitis who have skin involvement, what does that mean to them? And we actually were able to do, I don't think the study would have been possible any other way. We actually got hundreds of patients who've had vasculitis of the skin across different types of vasculitis. And there's actually a poster out there, so I won't uh, give away the answers, but go out and take a look at it when it's time of the poster thing, and you'll see that the impact is significant, and we were able to document that directly from patients. And that's now added, it's published in a dermatology journal, but it's available for all to be involved and understand it. An area that never was studied in the same way. We did this diagnostic validation studies. We were able to show that actually you all know your disease. You know, you're able to say you have this, and you probably do. We don't want you to have it, but if you have it, you're labeled it, you should actually have it. And so we're able to show that's important for research purposes. We had this Healthy Mind, Healthy You study, which was a trial looking at 2 different forms of mindfulness. And this was a multi-center, multi-disease randomized trial that we were able to do in efficient fashion, and we recently published results of that. It was a pilot study. We'll hear more about mindfulness and approaches in a moment. And then, I don't know if you heard about this thing, there was this virus going around, this SARS, COVID, something or other. Apparently it was a big deal. I got a memo about it. And when the pandemic struck, it struck our community profoundly because very vulnerable patients who are immunosuppressed, we were very worried, you were very worried, nobody knew what was going on. And then as we got to know more about going on, we were still worried, and there's still problems. And so at the time when the pandemic got, most research was shut down. I mean, truly shut down. The labs were empty, the wards were empty, we weren't allowed to do it. Patients were focused on one thing, which was the pandemic. We were focused on keeping patients alive and doing this. So we shifted to working on understanding the impact of COVID on our patients with vasculitis and vice versa. And we were able to actually do this. One thing that wasn't shut down was the internet, and to be able to actually do this work. So we actually published a few papers, both just about vasculitis and across different types of diseases, other autoimmune diseases. We compared and contrasted that, and that was very helpful. You were able to be empowered to be part of things going on, even if you were shut in at home. And so that was a good example of being flexible and being able to get things moving. Ongoing projects. So we have our disease cohorts. So everybody here who's in the VPPRN, you're hopefully filling out forms every 6 months. It takes about 10 minutes, and we ask for your data. And we have these now longitudinal data. So we have data on hundreds of patients over several years. That allows us to ask different questions of it. We can go back and say, how does it impact you this way? Or we can select patients for another study because we know about you, because you said, I'm okay with you knowing about me. And we will be able to select you for different things. So these ongoing registries are the key way that we get information, and we're using it for longitudinal studies. The Vasculitis Pregnancy Registry is exactly that. It's people who are pregnant are registering themselves. A woman who's pregnant will register herself. Again, doesn't involve the doctors. I got news for you. If you're pregnant, you know you're pregnant. I don't know if you need that confirmation after a while. It becomes kind of clear. They teach you in medical school all the tests, but I think people know after a while. And so they can actually go and register themselves. We collect data during the pregnancy. We want to know, what does having vasculitis do to the baby? And what does having vasculitis, carrying a baby, do to the mother? And these are critical questions. This is a critical part. Cassie Sims, are you in the room? Over there. So Dr. Sims is helping to lead on this. Dr. Close and I formed this and continued to run this with her, and Cassie is taking this on as a major part of her career. She's an early career investigator, and so she's been doing great work, and we have some new papers coming out on this, and we've expanded this to other countries and other languages, because I don't know if you know, actually people outside the United States get pregnant too. Who knew? So that's amazing. And so there you go. PANDA. So PANDA, predictive analytics via network distributed algorithms for multi-system diseases. I'm very proud of this acronym. I got, because now we just talk about PANDA. I don't have to say that whole thing again. And we have a cute little guy with the computer. This is actually a very interesting study. That is, we have actually a lot of funding from the National Institutes of Health for this. This is a study trying to predict. We're using healthcare data from millions of patients with vasculitis, and we're trying to see, how do we predict who gets vasculitis before they actually get it? Because you get lab tests, you come in with these symptoms, you go to the emergency room. When should that flag have been, whoa, maybe you should think about vasculitis? Because we know from a prior study that it takes way too long for many patients to get diagnosed. And so we're trying to do this in a very interesting fashion using machine learning, sort of an AI type of thing, to try to understand this better. And we have patient research partners doing that. This is going to take us several years. This is extremely complicated work, but it was triggered by another study called Journey, which was triggered by a patient's asking about this issue. They said, you want to know what to study? Why does it take so long to get diagnosed for some people? For some people, it's days. For some people, it's years. We can't have that. We can't have it take months. And so that led to study one. Study one led to this study. So we got some data that are coming soon. We've got our sleep vast study. So we got over 1,000 of you participated in a survey using validated instruments. We have a sleep scientist that's on this. This is led by Dr. Barra in Canada and one of her postdoctoral students. So again, young investigator, new people coming in, looking at sleep. Everybody hopefully sleeps sometimes, and I do sleep sometimes. And many people have trouble sleeping. Is it the disease? Is it what's going on? Is it the state of the world, which will keep you up? But we want to study this. There are physiologic reasons why sleep gets disturbed. So this is the first comprehensive approach to looking at sleep in patients with vasculitis, and we're analyzing those data now. And again, patients involved from the very beginning in thinking about how to ask the questions, how to do this research, how to analyze it. Vas Strong, Dr. Satui is leading on this at Pittsburgh. He was a vasculitis, a VCRC VF fellow as well, and he's leading on this study looking at frailty, looking at people who aren't as strong as you want to be. Many people lose muscle power and function. What is the impact of that on how you function with vasculitis? Again, across different types of vasculitis. Another unique aspect of the VPPRN is we often ask questions across multiple types. Neurologic involvement. Neurologic involvement is bad. It's bad to have neurologic involvement in vasculitis. You get a foot drop, or you get the funny feelings, the paresthesias, you have issues. It strikes many different types of vasculitis. This is an ANCA-associated vasculitis, particularly problematic. And this is led by Rula Haj Ali, the Cleveland Clinic, and others. And we're working with them, and we're looking at how many people get this, what is the impact, how does it affect? And we're doing this both in the VCRC and the VPPRN, as many acronyms as possible. And again, ongoing work, lots of data that allows us to really answer some interesting questions because it hasn't been looked at in a comprehensive fashion. And I already told you about the Vasculitis Pregnancy Registry, which is ongoing. So you're going to hear about these all soon. Upcoming projects, we are trying to launch a pediatric branch of this. We're not quite there yet. We need to figure out funding for that. It costs money to do this, but we'd like to particularly enroll more children and learn more. You think having a vasculitis problem as an adult? Try having it as a kid. So there are real issues. Some of you had it when you were kids and you started. So we'd like to focus a little bit more on that. Jessica Bloom, Dr. Bloom, are you in the room? Over there, Dr. Bloom, also a VCRC VF fellow. She's in Colorado, pediatric rheumatologist, is leading work in vasculitis, not just this, but she has led some other work. She has a poster out there also, take a look at, and she's helping to lead this with Dr. James and patient partners and others. And then vasculitis across the lifespan. That's the poster out there. That's the work that Dr. Bloom did, looking at how does vasculitis, what if you get it when you're 15 or when you're 25 or when you're 45 or when you're 75? How does that change? And actually, that work is out there, and that paper was recently accepted in our flagship journal of arthritis and rheumatology from the American College of Rheumatology. And so that's terrific for Dr. Bloom and all of us. And so that's work that's also ongoing. And we're going to look at that in VPPRN. And then we are, Dr. Hall here? He's going to be talking later. He and Dr. He is? Oh, there he is. Hey, there he is. He's going to be helping to lead this project with Dr. Wallace and others. They're looking at a way for mind-body intervention in vasculitis. And what we're first going to do is we're going to ask people in the VPRN, how interested are you? How interested would you be in participating in a trial of this? And I can tell you, I think the answer is probably highly interested, but not everybody might be. We need those information. So you're going to get an invite to answer a very simple survey about that. Why is that important? So I call that prep for research. So by getting X number of patients to tell us, I'm interested, I'm not interested, I have this type of vasculitis, Dr. Hall and Dr. Wallace, and working with me and others, can put in a grant to the NIH to say, we actually want to plan a study within this. And having that interest already showing that hundreds of patients have already said, we want to be part of it and we'll be part of it, is tremendously powerful when you're reviewing the grant. You say, well, these guys have a head start. They're really ready to go. So that is why we ask you to do those things. And then go out to the poster gallery. Dr. Gordon and I and Dr. Kamani and Dr. Bloom will be out there. There you see the posters, and we can talk a little about the work that we've done and why that's important. Really, it's just a sampling of the kind of work we've done, but it's great. It's the most recent stuff. Publications. Why are publications important? Well, as a former chief who I had when I was a younger investigator said, you know, what do we do in academic medicine? Well, you know, General Motors, they make cars. We write papers. And papers are important. It's important academically for your advancement. But more importantly, how's anyone going to know about your research if you don't publish it? It doesn't do a lot of patients good if I just keep it at the University of Pennsylvania. So if Dr. Bloom doesn't publish it and she hides it in the corner of her office at the University of Colorado, that's not that helpful. But if we publish it and we get it out there, then everybody can read it, patients and physicians, and that's the impact. And it is important that you get the work out. So are we publishing? You bet we publish. We publish a lot. This is just a sample of the papers. We've published a lot of papers through the Vasculitis Patient-Powered Research Network in important and good journals, and it's been terrific, and that's how you get the work out there. I think I already talked about this one, which is our Journey paper. That led to the PANDA paper. Again, the delay directly. Many of these other papers came from questions you've asked. I'm going to skip over this because I think we have time. And I talked about PANDA. I cut myself short by just saying it. I was so excited about PANDA. See the stethoscope? It's cute, isn't it? Yeah. I work with a graphic artist. I have so few skills that. And I'm going to ask Dr. Gordon to come up and talk a little bit about how you can participate in research. And she's my partner in all this. So come on up.
So hopefully after hearing some of that, those of you who are not members would like to become members. We have people in the room with clipboards, so if you want to circulate and sign up names while I'm talking, we can do that. Or you can see Christine out in the lobby. So why should you join the VPPRN? Well, those of you who are already members, hopefully this is why you joined. This is a chance for us patients to take part in important research. You can do it online at your convenience. You don't have to go to your provider's office. You don't have to go to a particular academic medical center. We can all do this from our homes or on our smartphone from anywhere. And it's really our data, the data that we as patients put into the registry that leads to new research, the type of research that Dr. Merkel and the docs here are working on. And this is the road to understanding vasculitis and developing new treatments for us. Our biannual forms have launched. Those of you who are in the registry know we come to you twice a year. It takes about 10 minutes. You fill out a couple questions. How are you doing? Have you changed any medications? Give us a score. Have you had any pain, any issues, any symptoms? And we collect all this information in the database. And it's this database that then we can use to develop the research questions and come back to you. If there's a particular research study like the ones Dr. Merkel mentioned, you'll see this in our newsletter or on the website. Also in the VF will help us communicate that. And you can decide if you want to participate in SleepVasc or VascStrong or one of the other ones. So you should have an email in your inbox from Christine to fill out your forms. Please fill out your forms. Christine will keep emailing you until you do. And there's a gift card available to the first people that fill out their forms. So this is a little incentive. There are flyers out on the table. If you are not a member, we want you. He wants you. We're going to track you down. You're here till tomorrow, right? This is our new community dashboard. I've been on the VF USA tour stops throughout the country over the past year, so you may have heard me talk about this. We're working hard to bring the data back to patients and share what we learned in the network. This is really critical. This is the only place, the largest registry in the entire world, that you can find out about what's happening in vasculitis. And this is our data. So if you log in and you're a member, you can see this information. It will tell you your own scores, what you reported previously when you said, did you have any fatigue or pain? And now you can see who else has fatigue and pain, for example. How do you compare with other people in the network? Are you having more or less compared to everybody with vasculitis? And then you can also go in and see for individual types of vasculitis. So like I have EGPA, I can go in and I can see what is the level of fatigue that others with EGPA have. And then what about looking at other forms of vasculitis like GPA and MPA, the other forms of ANCA? What does their pain look like? Is it similar for me as it is for other people? And if I'm not the same, then why is that? And this is how we can start to learn. Why are some of us still having these ongoing issues and some are not? How do we get us to move from the scoring with pain and fatigue being too high to under control and these lower scores? And we could do that by communicating together. So what's ahead? We want to expand the membership to include all forms of vasculitis. We are very interested in international recruitment, as Dr. Merkel mentioned. Most of us are in English-speaking countries right now and heavily in the US, and we're promoting this internationally. We will continue to work with investigators on new research ideas, and you can actually put research questions into the website, and we collect those and go through those, and we use patient-driven questions to help us identify areas of need. And we're very focused on returning data. We're going to continue to share. As Dr. Merkel mentioned this afternoon, there's a poster session at 4:15. We'll be out there sharing results. So if you have any research questions that you want to chat with us, we'll be there, and we'll be here for the rest of the conference. So I want to thank the patients in the room because it's our registry and it's our data and it's our community. We can do so much to help the docs do research, and ultimately that helps us. So please sign up for the VPPRN. And see Christine if you have any questions. Did you want to mention the
Sure,
supporters?
yeah. I don't, if we can get this on. Is this on? Hi. Yeah, you know, this is an efficient way to do research, but everything costs money. We have to pay our staff, we have to pay the work we do, and all the computer infrastructure behind us. And we've had a lot of funding from PCORI, which is an offshoot of the government early on, and from the NIH. We've also had funding from the University of Pennsylvania through our own development funds we've been able to fund. But especially the Vasculitis Foundation has been a steady supporter of ours. Again, we are the research arm of the Vasculitis Foundation, your Vasculitis Foundation, my Vasculitis Foundation, as you support that. We also have some industry sponsors, both GlaxoSmithKline and AstraZeneca have supported us, and we work with them because they know how important it is to get the patient voice input. I think that's a change that's happened, by the way, since I've been in research, which is both investigators, to be honest, and companies and the government are now recognizing, if you want to know how patients feel, here's an idea, ask the patient. And so we're doing that a lot more, and we're recognizing the importance of that. So we want to thank all of you and all of our supporters.
Thank you.
I think we have 5 minutes for questions?
We don't have many. I can open it up.
Yeah, you don't have to.
Sure. All right. We've got time for maybe a question or two.
Fill out the card on the table.
Yeah. That we have physical cards on the table. You can bring them up if you
This man
want.
ask a question, he's going to get coffee. I'll have a question for you, Dr. Gordon, which is, what does it mean? How does someone become a patient research partner? How do we select those, and what does that mean?
Yeah, so when we have a study coming up, then we will announce a call for patient research partners. So you can, you'll see this in the newsletter if you're a member, or you'll find it in the VF website. You can apply and tell us why you're interested in a particular project. It might be something that is important to you, like sleep fast or something, if you've had issues with sleep, or mind-body. And then we collect all of the people that apply, and we review their information and the answers that they give to the questions. And then Christine and I will meet with them, and then we'll select individuals that we think will be a good fit. And then they will participate actively in the project. They'll be able to meet with the investigators on an ongoing basis, and they'll be involved in all the steps of the research study. And I think we have several research partners in the room.
Yeah.
And any research partners here?
Yeah.
Wonderful, thank you. So you can ask them too what their experience has been.
We got a question, which is how do you share with rooms and I guess other physicians so they can learn more about quality of life issues? Well, that's a great question. How do we share? We publish. We publish the information in medical journals. We add those results to our lectures and our teaching to our trainees, and it all becomes part of our knowledge base in vasculitis, and that's why publication is important. Dr. Gordon, I get to pass a lot. Why aren't more men involved in the VPPRN?
That's a great question, Dr. Merkel. Let's ask the men. Why are they not involved?
Well, there's the self-selected group. So one of the issues is that in the VPRN, there are more women proportionally than even for some of our diseases are more common in women, but not all. But even beyond that, there's more. And that's actually not unique to this network. That is actually common to all online research networks, and it's common in research in general. Women are more likely to volunteer and be part of research enterprise than men for a variety of reasons. There are some known, and I'm sure you could come up with some of your own. But it is an issue because as difficult it might be to understand this, men are people too, and they need to, so we need to get some data from them as well. And so we'd like to encourage more men to be involved so we have a better representation across. This is an issue in research in general. You could ask also underrepresented minorities. These are, look around the room, we need to increase the diversity of membership in everything that we're involved with in society, and I think this is especially true in research. We're very sensitive to the issue of making sure we can be as inclusive as possible. So these are ongoing challenges, but they can't be excuses. So we have to say, okay, we have an issue, let's embrace it, and let's try to make it stronger. So go out and, I'm not going to use the word grab, that's probably the wrong term, but go out and get some more people involved in the VPPRN, men and women both. And if everyone here gets 2 more people to be involved that you might be involved in your social network, we'll have a lot more people.
We have one question that I think is really important, so I'm going to ask it. It's come in online. How confidential is the patient information that you get?
I think we'll both answer. I was going to ask that of ourselves. So how confidential, how secure are the data? The data are extremely secure. Part of what we pay for is extremely good database and extremely good people, data professionals who know how to store data properly. We have significant protocols for data protection. Actually, every patient partner is also taught about data protection, et cetera. We don't release individually identifiable data to anybody. We keep that data within. We know who you are, and we can contact you through the network, but we do not release that to others. So it's very secure. It's not hackable. I mean, we have never been hacked. That's not an issue. This isn't stored on Christine's laptop somewhere. This has a very secure backbone. And it's a great question because I think we worry about that for all of our healthcare, but it's very secure.
Yeah, you can find out more information about our privacy and our data policies online as well.
We thank you all for the update of the VPPRN.